Hey everybody, good morning, welcome back. Today's show is all about making things just a little bit better, taking a steak to the next level. We're going to show you how to make just a wonderful salad. Salads can be so boring. Well, not this salad. Also, what about your relationship? Want to make your relationship a little better? We'll talk a little bit about that. And what about your smile or your kid's smile? Joining us to talk about early orthodontic care is Mary Kennecke from Janssen Dental. Good morning.
Good morning.
First of all, Mary and I were talking about I had braces, and back in the day, it was like a 5-year thing. Every picture from 6th grade through high school, there I am with my braces. Not so anymore. It's come a long way, this technology.
It certainly has. What we have found is starting children early enough and creating the space needed that Mother Nature isn't quite giving them eliminates or really lessens the chance of them having to have teeth pulled when they're older for braces. So putting them into an appliance such as a removable or a fixed appliance and helping Mother Nature create the space definitely helps.
And also, I'm imagining if you catch it early, you can cut down on expenses and a lot of things. So I think people think braces, that's a 10, 12, 13-year-old thing. Not so. When would you like to be looking at these kids and determining what they can do as far as braces and orthodontics go?
As early as 5 years old.
Really?
Depends on the maturity level of the child. My daughter, for instance, we had her first appliance in at 5 years old. She went through a couple of them. Her baby teeth were crowded, so needless to say, her permanents were also coming in crowded. So by putting these appliances in and helping stimulate the bone growth, she actually now doesn't have to have braces.
Oh, that's amazing. Yeah. So again, that's just the early. What about adults and braces? I think some people think that they weren't able to have them as a kid, and they've always wanted to get them. Are you seeing a lot of that?
Actually, we are. A lot of adults that put their own mouths off for their children are now going, can I get them? And we actually put appliances in adults, pre-braces, to help with the spacing. So then their actual time in braces has been cut down also.
Which is amazing, wonderful. Yes. Yeah, it's usually not the 5-year plan like me anymore.
Yeah, exactly.
All right, and of course, come in for a consultation, get in early, as your regular checkup, also be asking a lot of questions.
Exactly. What we do is ask parents to look at the sleeping habits of a child, especially if they have airway issues, allergies, that can have a negative side effect to the growth. So looking at their tonsils, adenoids, the airway obstruction.
All right. So thanks so much,
Mary
Kennecke from Janssen Dental. Appreciate it.
Thank you.
Coming up, we're going to talk about a little help with your relationship, and also we're going to make the best salad you've ever tasted. So stick with us. We'll be right back.